Hello, my name is Rob Jones. I'm a genitourinary medical oncologist in Glasgow. Um, and we're here to talk a bit about patient communication in the context of advanced urothelial cancer. And I'm delighted to be joined by a patient of mine, Anna Thompson. Anna, do you want to just introduce yourself and give us a little about your background, both personally and health-wise?
Hi there, my name's Anna Thompson and I'm aged 58 years of age. Um, and up until about 2 years ago, I worked for the Scottish Court Service as an admin assistant and clerk of court. Had to take early retirement due to the cancer. Um, I'm also mum to two daughters. Um, One who's a nurse and one who's training to be a midwife. And I'm also raising a niece who's 15 at the moment. I've had her since 2016, just before the cancer. Um, and her father had died early from cancer. Um, and I myself was diagnosed with ureter cancer back in 31st of January 2019. And I was given the news in March 2019 that the cancer was incurable. Um, Thereafter, um, I went on to chemotherapy, and at the moment, my condition is currently managed by immunotherapy, but I've also had a session of radiotherapy as well. So that's kind of my up-to-date position at the moment with it.
Thanks so much, Anna. So I want to start the conversation maybe by talking a little bit about the language that particularly doctors use, but I mean other healthcare professionals as well, but the language we use when we're talking to patients. And I think doctors, we're constantly being told that we use jargon all the time, and that people often don't understand what we're saying because we use language which is too complex. But I think there's also a danger that we respond to that by talking to everybody in a very childlike fashion, which is often oversimplistic. And so sometimes we struggle to get the sweet spot right. And I'd be really interested in your views and maybe your experiences of this, and in particular, thinking about, is there a one size fits all type of language that we use when we talk, whether we should use when we're talking to patients?
My personal thoughts on it are I don't think there is a one size fits all for the patients because, as people, we're all unique individual, and some people, like myself, can. I'm a realist and I prefer to have the information, and I can deal with it. Once I've got the information, to me, knowledge is power. I like to be in control. But I do believe there's a lot of people would prefer just to have the basic um, understanding of it, and they don't want to ask questions because they don't really want to know. So I don't think there is a one size fits all for everybody, and I think really that's down to um, that's something for the doctor to assess, as in when he's talking to said patient, of how confident they are with it, or is it they can't really face the information and it's better helping them to just give them the basics that they want to hear and get out the door. Um,
So you're saying that and it's not just the way we say it, but actually what we say, that some patients wish and need different levels of information. Is that what you're saying?
I believe so.
One of the areas where I think communication is essential is when we're helping patients make choices. I think particularly in advanced cancer and advanced urothelial cancers, no different in this regard, is there's nearly always when you're changing treatment or making a decision to initiate or change treatment, there's nearly always options available. Now that might be a choice between two different active treatments, such as between chemotherapy and immunotherapy, or it may be a choice whether you actually want that treatment at all at this point, or whether supportive care alone is the it would be the more the better way forwards. Uh, how involved do you think that patients want to be in these decisions? Or do you think it should really be up to the doctor to make the best decision for that patient?
I believe every patient should be involved, and I believe it should be a conversation between the doctor and the patient where they discuss the options thoroughly, that the patient isn't got all the facts, listens to the doctor on his opinions, but also the doctor to listen to the patient. For instance, when I'm on immunotherapy at the moment, but there was conversations when I went on to this session of immunotherapy of other treatments that were there and perhaps might work, perhaps even better. But because I had been on immunotherapy previously and it worked so well, and I just felt that it really worked well with my body, there wasn't side effects from it, and I felt I would like to try that again just to see if we can get the same results before going to trials or different treatments. And my opinion was listened to, which I was quite glad about, because it then also, if this doesn't work, then the treatments are still there. Who knows? Maybe there'll be more by that time. There's new things coming out all the time, but it was good that I had an input into it, because I know my body as a patient. I know my body, and I know what works, and I know where I am with regards to having the strength to fight things, and how much left I've got left in the tank regarding energy to get through these things. So I just felt at that time I had enough energy and enough fight to try this another time before we move on to the next thing. So it was good. It was good to have that input.
So what you described there is sounds like a situation where you were very much presented with more than one option, and very much your views were really important in making that choice. When a doctor is presenting more than one treatment option, do you think the doctor should also their opinion as to which they think how far should the doctor be steering about their view on things, or should they really just present the options to you and help and ask you to make a choice? How should this work?
No, I think the doctor should always present their views on it, because in my case the views were presented, and in the case in my case, there wasn't really much between it, whether I tried this one or we tried the next one. So why not try this one first and see if it works? But I was presented with the views and which one did what and what would work for me. So it helped as well for me to be sure about my decision, because the doctor was saying, well, yes, there's not a problem to try this before we go to this. That enabled me as well to be sure about my path of thinking. I would always listen to the doctor. If what I was thinking, for instance, was something else than what the doctor wanted, I think his opinion has to be the final matter on it, to be honest with you, because they really use guys know what you're doing. You deal with this day in, day out, and your opinions count, and it's important as patients that we know what your opinions are before we make up our own. So I had my doctor's opinion before I made my final opinion known.
one very specific example, which I know you've been through, but it is not uncommon in urothelial cancer, is sometimes there's a choice between chemotherapy and immune therapy. And I don't know if you can remember how that was presented to you, but I wanted to know how easy you found it to, obviously when you're considering those options, you're kind of weighing up the pros and cons of each approach. In particular, you're weighing up the different side effects against the different likelihood of benefit. How can you remember how easy that was, just weighing up those really sometimes quite complex balances, particularly around the side effect profile of the two treatments? Can you remember how you managed that situation?
For myself, it was presented at first when I was going onto treatment, and it was after the operation. And the point was to just mop up any cancer that was perhaps in the body. And it was presented that probably chemotherapy would be the best way to go, with a view that immunotherapy was there to fall back on should it come back or when it came back. So it was kind of straightforward for me in that I didn't have to think too much about those choices at that time. And for the side effects, those were very well explained by the doctor. I was prepared for them. I had lots of questions, and I knew it was very scary. I can remember at that time, it was one of the scariest things I've ever done, because when you're getting it as a patient and they put that bag up, it just looks like poison, and then it goes into your arm and you're thinking, oh my Lord, what's going to happen next? I don't like this. But I knew that I knew what to expect, and it wasn't pleasant. But I got through it. But I also knew that should it come back, I had that cushion of there was immunotherapy there that I could fall back on. And also, I was at the time when it came back offered the chemotherapy. At that point, I had known how bad the chemotherapy had made me feel. I knew the level of energy that I had, and I wanted to go with the immunotherapy. And I found from day one that that didn't give me any side effects. It was much more gentler for me, and it controlled my cancer well.
Having experienced the side effects of chemotherapy, that became quite a powerful motivator in your second treatment choice there.
Yes.
I know you're on active treatment at the moment, but how easy do you think it would be to make a choice between active treatment and maybe not having active treatment and choosing supportive care? I don't know whether you can sort of put yourself into that position where there is, because there's always that choice of not having active treatment. How easy do you think it would be to make that choice? And maybe what would be the important things you would want to know to help you make that choice?
I think about it every day. As a cancer patient, there isn't a day goes by where I don't think about that conversation that we're going to have one day. I know it's coming. I just don't know when. And at that point, I'll have to make that decision that you've suggested, whether is it survival by any means, or if the treatment isn't doing anything and so we're going to give you another few weeks or months, whatever, is it better to have quality of life? I'd like to think I'd be brave enough when that time came that I could make that decision to enjoy. I try and make the most, enjoy is not the right word, try to make the most of the last few months I have with my family. So I'm hoping, praying that I'm brave enough to make that decision, but it's a hard thing to look ahead. Up till now, I've managed my condition with a lot of common sense, just staying calm, just dealing with it day by day. So hopefully I can do the same thing when that conversation does arise.
Well, just move tracks slightly now, because I think we talked a little bit earlier about the how some patients need more information than others. Um, I think that one of the key things we kind of have, as doctors, we have to be honest about is what the purpose of treatment is. Um, in advanced urothelial cancer, um, we're not giving the treatment with the intention of curing the patient. And I think so for example, so I think it's really important that the patient clearly understands that whether the purpose, if the purpose of the treatment is to cure, or if the purpose of the treatment is to control the disease without cure. Um, so when we're discussing non-curative treatments, which of course has been the case with you, how do you think we should discuss that balance between quality of life, which you mentioned, and the quantity of life that the treatment might the extra quantity of life that the treatment might give you?
I think the one word that springs to mind is honesty. I think at that point, patients, whether they want to or not, need to be in full knowledge of the facts of, just like I said before with the chemotherapy, you need to know what's coming, how to deal with it. This is the same thing. If honesty, then you're in full knowledge of the facts if you choose survival by any means, what those end days might look like for you, or what I'm hoping when the time comes, and it comes to that point for me, if I choose supportive care, that I can have a full and frank conversation and have it explained to me what that will look like, what to expect.
So it's always a bit of a balancing act between quantity of life and quality of life. Do you think that different patients will have different perspectives on, how to make that balance?
Definitely, definitely. Um, I think for some, they just might be so desperate not to leave their family and want to grab every day that they can with them. Um, it's a hard decision. That is one of the hardest you'll ever have to make. But I think it would be better on the family. For me, I think it's better on the family if I don't put that on them. And that's not the way I want them to remember me. So that would be one of the influences on my decision on that. After discussing it with the doctor, how each one, what it would look like, then I could think, well, how do I want my family to remember me? Is it worth to do this, to give them the extra days? Is this going to look terrible for them? Or is it better to be dignified and just go down this route once I know what that's going to look like?
Now, the other area that interests me is that you know quite often there are treatments which are we regard as doctors regard as conventional treatments, which we can give you, we can offer you. There are sometimes where I work, certainly, there are sometimes treatments out there which we would like to give you, but we can't offer. And of course, there are sometimes treatments out there which patients have heard about or patients are, are interested in, which we wouldn't regard as part of the conventional weaponry we have on offer. So we wouldn't offer, for example, there's been a lot in the media in recent years about cannabis-related extracts, things like that. Um, how do you think? So it's not uncommon for a patient to come to me in the clinic and say, "You've given me these options, doctor, but what about X, Y, and Z?" How do you think I should handle these inquiries?
Um, well, there has been many times that I have thought of in the past, as you look into all different things, And I have thought about asking you, is this beneficial or not? But I always keep in mind common sense kicks in because you're on other medications, and especially with the immunotherapy, if you start messing about and taking other things that maybe it's got anti-inflammatory things in it and all the different things, how is that going to interact with my immunotherapy drug? And I have to always keep that at the back of my mind, that that's the most important thing, that works and that stays okay. Nothing interferes with that. I prefer to stick with what my doctor recommends for me. Uh, Obviously, healthy eating and all the rest of it, by all means, do these things. There's fruits that they say are very good and help, things like that, but I wouldn't take any other drugs. And I'd expect my doctor, if I asked these questions, to say that to me, that, you're on a drug that's to manage or control your cancer, and it's safer for you not to be interfering with that for something that's not proven.
So the other areas where you and I live, and in many other countries, there are sometimes drugs which I would like to be able to prescribe, but for reasons, usually financial reasons, I can't offer them. Should I tell you about a treatment even though I know I can't prescribe it for you?
Yes, and we've had one of those discussions where I I was informed about another drug that may help, um, but I think you should always inform the patient. As I said, knowledge is power, because yes, I can't afford it just now, and it's not going to upset me because I know, I could go to a showroom and I could buy a Mercedes or a Bentley if I had the money, but I don't, so I can't. So it's the same thing with the drug. It's there, I can't afford it, but it's nice to know it's there, because if I do, I could win the lottery next week. That money could be there. If I know about that drug, I could then come back to you with that discussion if things changed in your life, which happens. So yes, I think knowledge is power, and I think the doctor should be discussing all the options with the patient.
And the other area is clinical trials. Uh, some hospitals, including mine, participating in clinical trials. Would it occur to you to ask about this, even if I didn't offer you a specific clinical trial at any point?
Because you don't know about them, I don't think you really would, unless you knew trials were going on and you knew anything about that side of it. But off the top of my head, unless it was discussed with me, I mean, just I know you've talked about one with me, but I couldn't tell you what other trials are out there. I don't know. I don't have that knowledge, so probably wouldn't unless it was brought up and discussed with me by my doctor. Um, I don't think I would know to raise that subject and talk about it.
Uh, uh, our hospital is it's a big organization. There are hundreds, if not thousands, of staff here, and as a result, often a patient will see different people at different visits. As a, and acknowledging that it won't always be practical for a patient to see the same person every time. How important is it that continuity of care, continuity of communication? Or is it more about trusting whoever it is that you're seeing, that the communication is joined up?
Mm-hmm. Well, I've got a couple of examples here. The one is the main one is my communication with my oncologist, and I see him most of the time, and when it's important calls, it's always my oncologist. And in between times, there are times when he can't always be there, that he has like he's next in command. He'll give me a call, and I'm quite happy with that. If everything's straightforward, I'm happy to have those conversations because I know through talking to the person on the phone that they've been in touch and been talking to the oncologist. They know the situation, they know what the situation is and the questions to ask. And I can ask them again any questions. And if there's anything they're not sure of, they say they'll go back to the oncologist and they'll be back in touch. And that's how I've always found it. And it's worked for me. I've never found a problem with that. So as long as I have my oncologist for the important discussions or things that perhaps crop up. And if I need to get him, if there's any problems, I contact the secretary who contacts them very quickly, and it's almost immediate response usually for to have contact with my oncologist about problems. And that brings me to the second point where it happened recently, where I developed a cough because my tumour had started to grow. And I contacted the secretary who contacted the oncologist who phoned me straight away. And he said the best course would be to get me onto radiology and get the tumour just zapped a little bit with the radiotherapy. And he immediately phoned the radiotherapist who immediately phoned me. It was so fast, so fast. And she had me in within the week. And the following week, the treatment for radiotherapy was arranged. So within a fortnight, I had gone from just having a cough to being actually in getting the radiotherapy treatment. It was amazing, amazingly fast how it just all ran so smoothly and they all talked to each other. And I got my treatment, and which helped and relieved my symptoms. So I'm grateful for that, because if that hadn't happened, I wouldn't have had. I've got quite a good quality of life at the moment because of that. The communication between everybody and getting the treatment where it was needed quickly. It gave me now a better quality of life again for another little while. So
we're saying that it's not just important we communicate well with you and I communicate, but actually we've got to be communicating with each other well in the background. Yeah. I want to move on now to what I think sometimes can be quite a tricky area, and this is around prognosis. You've already mentioned on the importance of honesty, and I think actually it's not just healthcare relationships. Honesty is important in all relationships, isn't it? I'm sure you'd agree with that. But no more so than when it's a doctor-patient relationship. But sometimes there's a difficult balance between honesty and optimism. So, particularly when we're talking about prognosis, how important to you is it that the person you're talking to retains a sense of optimism, even when the situation isn't actually looking that good?
I would hope that when that time comes and we have that discussion, that things aren't going well, that you can retain that optimism there, because you're not giving me optimism. I'm going to give you another year. I can make things better, but you perhaps can give me that optimism that, it could be another few weeks or that extra week, just that hope. It's given that if you're giving out that bit of optimism, you're not telling a lie. You're not telling me something amazing is going to happen, but you're keeping alive just that wee ember of hope that, it's not the immediate end, and we've still got a next stage. And
so you would hope there. How can doctors convey hope even when, as I say, the news isn't good? Can you give us any sort of tips on how we convey that hope even in a really bad news scenario?
well, I think it's just not to make it so doom and gloom. I think you've just got to deliver it with it honesty and just how it is. But at the end, just perhaps add on, but we're going to do this first, and you know, perhaps this will be you're going to go to supportive care, and they're going to look after you really well, and don't worry, and you're going to be taken care of. I think that's it. You're going to be taken care of. Don't worry about it. We're going to be there. We're going to catch you.
So it's about alleviating fear as much as imbuing hope. Yeah. Okay. Look, Anna, I think we're out of time. Thank you so much. I know it's really quite difficult, when you're the patient to bear all in a way like this. So thanks ever so much for agreeing to take part. Um, uh, just sort of wrap up. We've discussed. We've been trying to focus on doctor-patient communication in advanced cancer, particularly with reference to advanced urothelial cancer. But I guess what we've covered is the importance of language and trying to ensure that we use the right language and the right levels of information to suit the individual patient's needs. And we talked a bit about how we help, how important communication is when giving choices of treatment. But I think something that you said, which really struck home with me, that actually it's a two-way conversation. I've got to be listening to you as well as you listening to me in making those choices. And then we've talked a little bit about the importance of information around treatment options which maybe aren't available to the patient, as well as the ones that are, which I think is a really it's always going to be a challenging area as we continue to make progress in medicine. And then finally, we've talked a little bit there about the importance of honesty, but retaining hope and alleviating fear, even when the honest opinion is quite challenging for both parties in the conversation. So thanks very much once again, Anna, and we'll draw this conversation to a close.
Okay, well, thank you for allowing me to help out and be a part of this. I'm just glad to be able to give anything back that I can.